Serotonin and norepinephrine reuptake inhibitors, or SNRIs for short, are a class of medications that are used to treat depression, anxiety disorders, and neuropathic pain. These drugs work by blocking the reuptake of serotonin and norepinephrine. In this video, I'll share with you my visual mnemonic to help you remember all the information you need to know about SNRIs. It looks like we're watching a Western movie because of this desert background and these big mountains. This showdown between the characters is happening during a beautiful sunrise. You know how the key battles in Western movies always happen with the scenic sunrise? This sunrise is important because it should help you remember SNRIs. Get it? Sunrise for SNRIs? Because SNRIs just stands for sunrise. Actually, SNRIs stand for serotonin and norepinephrine reuptake inhibitors, a class of drugs that work just as their name suggests, by blocking the reuptake of both serotonin and norepinephrine. But before we get too far into the weeds here, let's explore more of this showdown to learn the drug names of SNRIs you need to know for test day. No Western movie would be complete without a duel, right? And these two people are definitely dueling, as evidenced by the pointed swords at each other. You should use this duel to remind you of the drug name duloxetine. Get it? Duel for duloxetine, or duloxetine, if you will. Duloxetine is one of the SNRI drug names that you should be aware of. The stakes of this duel are pretty high, as evidenced by the venom our villain is spreading on his blade. You know how you can make a sword extra deadly by covering it with snake venom? By the way, venom should help you remember venlafaxine. Get it? Venom for venlafaxine? Venlafaxine and its related drug desvenlafaxine are the other major SNRI drug names that you should know. For extra brownie points, the other SNRI drugs include milnacipran and levomilnacipran, but those two drugs are much rarer and not at all likely to come up on test day. Now that we've covered the names of the common SNRIs, let's find out how these medications actually work. We're halfway into the movie with the high-stakes duel here, and, of course, our streaming service picks this exact moment to collect some user feedback. Take a look at this pop-up here in the corner. It looks like one of those rate these movie pop-ups with all the smiley faces being at different rating. Anyway, the smiley faces here are our recurring symbol for serotonin. You know, a smiley face for serotonin, since serotonin is the feel-good neurotransmitter. SNRIs function to increase serotonin signaling in the brain. SNRIs do this by blocking the reuptake of serotonin at neuronal synapses. And they do this by blocking transporters that take serotonin out of the synapse and back into the neuron that releases it. These transporters being blocked are called reuptake transporters. By blocking serotonin reuptake, SNRIs cause an increase in serotonin levels inside the synapse. This increased serotonin can then go on to activate serotonin receptors on the postsynaptic neuron, leading to an overall increase in serotonin signaling. This increase in serotonin is partially responsible for the mood-altering effects of SNRIs. Now I see why the villain is trying to fight our good guys here. The villain must be trying to get his hands on that treasure map in our hero's hands. Let's take a closer look at that map, shall we? Like any map, there's a giant N for north to help you orient. Well, let this north symbol remind us of norepinephrine, or NE. Get it? Because north sounds like norepinephrine, or northepinephrine. Serotonin and norepinephrine reuptake inhibitors don't just increase serotonin signaling, they also increase norepinephrine signaling. You see, SNRIs also inhibit the reuptake of norepinephrine from the synapse. This increases the availability of norepinephrine to bind to postsynaptic receptors, increasing the total amount of norepinephrine signaling. It's thought that this increase in norepinephrine signaling can also play a role in altering mood. Now that we know the mechanism of SNRIs, let's find out what SNRIs can be used to treat. Like any Western or Indiana Jones-esque movie, we always have an accompanying love interest and sidekick, right? It seems that this love interest is crying, maybe because she's worried about losing her lover in this duel. I mean, come on. You'd probably be sad too if your significant other was getting into a life or death fight. By the way, this crying and sadness here should help you remember depression. Get it? A crying, sad person for depression? This is here to remind you that SNRIs are first-line treatments for depression along with SSRIs. We already covered why SNRIs are effective since they increase levels of the neurotransmitters serotonin and norepinephrine in the brain. Now that we've covered the main indication of SNRIs, let's learn about the other conditions SNRIs may be prescribed for. Now, let's take a look at that sidekick here. The sidekick is always less confident than the hero, and you can tell by his anxious expression here. Yep, that guy is positively shaking in fear for the hero. Well, anyway, the nervous, anxious expression here should help you remember anxiety disorders. SNRIs can also be used to treat a range of anxiety disorders, including generalized anxiety disorder, PTSD, obsessive compulsive disorder, panic attacks, and social anxiety disorder. All in all, just remember that you can use SNRIs to treat anxiety. Moving on, notice that this duel had to happen because our villain has the hero's crew backed up against an electrified fence. You know how Western settings always have electric fences and stuff for livestock? Well, the sparking wires of this fence serve to ramp up the noradrenaline yet another level, since it cuts off the escape route of the good guys. By the way, the sparking wires should help you remember neuropathic pain, since wires can remind us of nerves, and neuropathic pain can feel like shooting sparks into the body. SNRIs can also be prescribed to patients with neuropathic pain. For example, SNRIs can be used to treat diabetic peripheral neuropathy and fibromyalgia. Now that we know the clinical uses of SNRIs, let's review the adverse effects of these drugs. We've taken a look at everyone except the hero who is fighting the villain. As his lover comes in for a farewell kiss, our hero holds his hand up to block her. This isn't the end. It looks like he is refusing his lover's kiss because he thinks that he can actually win this duel. Coincidentally, this man blocking a kiss should help you remember sexual impotence. Get it? Blocking a kiss for sexual impotence? Since he's blocking a sexual advance here, right? Sexual impotence is a common adverse effect of SNRIs. Similar to SSRIs, patients taking SNRIs often have low libido or sex drive and can also have difficulty achieving an orgasm, referred to as anorgasmia. These are fairly common complaints patients have taking these drugs, making sexual impotence relatively high yield for test day. There is another primary side effect of SNRIs that you should be aware of. To find out what it is, let's go back to the smiley face rating system. Notice how the ratings here are a bit rigged. You can only pick from a bunch of smiley faces. Just like Pixar's videos, this duel is so good you can only have a positive reaction to it. Anyway, the excess smiley faces here should help you remember serotonin syndrome, a disorder basically caused by an overload of serotonin signaling. You see, any drug that modulates serotonin levels can cause serotonin syndrome, a disorder characterized by altered mental status, diaphoresis, clonus, and muscle jerks, and hyperactive reflexes. Serotonin syndrome is especially common when taking SNRIs with other drugs that also increase levels of serotonin signaling, like the monoamine oxidase inhibitors or the tricyclic antidepressants. Serotonin syndrome is a medical emergency, and it is usually treated with cyproheptadine, which works to block serotonin receptors. That was a lot of information, but just remember that SNRIs can contribute to serotonin syndrome, which is basically an overload of serotonin signaling. Make sense? There's one last major side effect of SNRIs that we should briefly mention. Take a look at the jetpack the villain has on his back. Since jetpacks basically work by shooting pressurized air, they are obviously under high pressure, which is further evidenced by the high-pressured labels on the jetpack. These high-pressure jetpacks should help you remember that increased blood pressure, or hypertension, is another potential adverse effect of SNRIs. The increased blood pressure, or hypertension, is a dose-dependent effect due to the increase in norepinephrine signaling. Got that? We've covered the most important adverse effects of SNRIs, but let's briefly touch on some of the less important ones as well. Some common but non-specific side effects of these drugs include nausea and dizziness. Again, these are pretty non-specific, so they won't really help you to pick SNRIs from answer choices on test day. Another characteristic relevant to stopping SNRIs is antidepressant discontinuation syndrome. Antidepressant discontinuation syndrome happens when patients discontinue or abruptly stop taking an SSRI or SNRI. This causes a constellation of nonspecific flu-like symptoms like nausea, fatigue, and headaches. A general rule of thumb, most drugs should not be stopped abruptly and should instead be gradually stopped with a taper. This is a pretty niche finding that really won't matter unless you're taking the psychiatry boards, so I'd focus your attention on the other symbols in this story. Alright, that's it for SNRIs. Let's summarize. Serotonin and norepinephrine reuptake inhibitors, or SNRIs for short, are a class of medications that include venlafaxine and duloxetine. SNRIs work to increase serotonin and norepinephrine signaling in the brain by blocking the reuptake of or transport of serotonin and norepinephrine out of the synapse. Clinically, SNRIs are used to treat depression, anxiety disorders, or neuropathic pain. Some of the key adverse effects of SNRIs include sexual dysfunction, serotonin syndrome, and increased blood pressure. Okay, now we're finally done. The duel is about to resume again, so let's sit back and watch the action. I'll see you in the next one.